So my name is Dr. Wendy Garvin Mayo. I am a nurse practitioner. I'm actually a grief coach. I'm also the founder and CEO of Collaborative Cancer Care. We are a practice here in Manchester and in Newington, and we provide mental and emotional support for cancer patients, caregivers, and their family members. And these Wellness Within webinars are a series that we're doing just to provide more value to the community. And grief and cancer is something that comes up for many of our clients. And this will be me just kind of talking through this topic with you to make it, to me, it's a little more personal than a slideshow. But we're going to talk about grief and cancer and what that looks like. As we're going through this, though, I'm going to ask that you have a pen and paper next to you. I always say anytime I'm doing a workshop or webinar, that my goal is that you leave here with actionable steps that you can take and implement into your life, or share something that you learn with someone else who may be experiencing grief or currently grieving. And you were giving me one of your most valuable assets, so I'm very grateful for that. But let's go over and get started with this workshop. So grief is often associated with death. Many times, if we lose a loved one, lose a friend, a family member, we think of grief, but grief shows up throughout our cancer experience. I also should say that I am an oncology nurse practitioner as well. So I have been face to face with many patients and caregivers and family members who experience various types of grief. And grief can show up in your cancer experience from the time of diagnosis into survivorship. In this state of Connecticut specifically, but even nationally, the number of cancer survivors is expanding. So we are doing a great job in medicine of keeping cancer patients alive and they're surviving. But one thing that I'm seeing is that even though cancer patients are surviving, are they living a good quality of life? And grief is something that can really be a lid or be a problem where cancer survivors are not living a full or good quality of life. Grief can also show up in caregiving. And today we're going to explore the different types of grief. We are also going to discuss how to cope with grief, like some strategies, and really how to foster connection and resilience, because that's where it really comes in. Because when, no one asks for cancer, no one asks to be a caregiver, it just happens. It just drops in your lap and your whole life shifts. And that's something, healthcare professionals, I'm even speaking for myself, I don't know if we really think about the holistic impact that cancer can have on a person and their family members. So in cancer, grief is not one dimensional, right? It's very complex and it continues to evolve. So it looks different every time. And research in clinical practice has helped us understand that grief shows up in multiple ways, in multiple forms. So we're going to talk about different types of grief, but I also wanted to just kind of go over like in the cancer community, you can grieve over loss of hair, loss of independence, changes in your body. Your body may change if you had surgery, if you're going through chemo, if you're going through radiation, changes in your future plans. No one plans to have cancer. No one plans to be a cancer caregiver. And many times we're thinking about our future or what our life should be or was. You can grieve that. You can also grieve the loss of ability to have children. There's fertility issues that go along with, having cancer and even treatment. You can grieve your pet. You can grieve so many things. And I think this is a concept that many don't think about when we think about grief. We think about grief more so with death. But the reason I'm doing this workshop is really to bring awareness that grief happens outside of death. And I just want to go over a few types of grief that you may have heard the definition of, or it may be new to you. But normal grief. This is a typical emotional response to loss, including sadness, anger, and acceptance. And you're going to hear a lot of the different emotions that you may feel. But an example of normal grief is a person feels sadness after the death of a loved one, but gradually adjusts to life without them, right? That sounds very normal. It sounds like a normal response to have if you lose a loved one. Another type of grief is anticipatory grief. You're anticipating the grief. So grief is experienced before the loss. And, this can be a terminal illness. And I'm going to tell you very personally, for me, my mom has Alzheimer's dementia. I am experiencing some anticipatory grief as she continues to lose different abilities in who she was or who I perceived her to be as a mother. That's an example of that, but it's anticipating that, just the progression of the disease. But same could be with cancer or anything else. Then there's complicated grief. This is intense, prolonged grief that interferes with daily functioning, lasting for more than, months or even years. So this is a complicated grief. And I think anytime you're grieving, and we're going to get into this later, but I feel compelled to say it now, it's also important to have support and community around you. But an example of complicated grief is a caregiver struggling with persistent, debilitating sadness over years of their loved ones being gone, unable to move forward. Many times we, lose individuals who have been in our lives for most of our lives, right? And it's an absence. So that can be very hard to kind of cope with and kind of move through. And that's complicated grief. We also have disenfranchised grief. This is grief that is not publicly acknowledged or validated, often because the relationship of the loss is not recognized by society. An example of this can be a loss of a friend or a cancer patient that feels unsupported in their grief because others only acknowledge family members' loss. So that can be you lost a friend, but it's like, why are you so upset? It's just a friend. It's not like it was your sister. It's not like it was your mother, right? So people don't have the same significance. So that can feel very lonely and isolating if you are grieving someone in society or people around you, like, why are you grieving that, right? So an example I think of is like when Michael Jackson died. I mean, the world was so heavy and sad, right? But people, you didn't even know him, you never even saw him, right? But it's really the significance and the bond you build with people, even if you don't know them. So that's an example of disenfranchised grief. Then we have collective grief. This is shared grief experienced by a group following a significant loss or tragedy. So this is like a community grieving the death of a local leader or a president or a politician or someone that was really significant in the community, but it's really not grieving alone. You're grieving in a group. So it's a group of people who really feel this grief and really understand. So you definitely have community and connection there. And then we have ambiguous grief. This is a grief experience when a loved one is physically present, but psychologically absent. And this can also be used an example, the one I use with my mom who has Alzheimer's dementia. She's physically here, but mentally she's not the same. And this can be hard for caregivers and even for the patients who are also grieving. So there are various types of grief. And I think when we talk about grief, it's important to put it into context as to what type of grief is this person experiencing? What type of grief am I experiencing? And I would love for you to take a moment to just think about what type of grief are you experiencing? How is grief showing up in your journey right now? Or even someone close to you, if you're currently not grieving, you're just here for information. But how do you think grief is showing up for them? And I want you to take note on your the piece of paper that you have, but just do some reflection on how is it showing up for you in your journey now, or how is it showing up for someone else? So just take a couple of minutes there. And if you want to share in the chat, more than happy to. You don't have to, but more than happy to. All right. So for those who came in a little later, I ask that you have pen and paper just to take some notes on some of the things that we're doing. So I will have some reflections and ask you to write some things down so you can have something to take with you. So now we're going to talk about healthy coping strategies for emotional stress. And grief is exhausting, right? And that's why we're talking about how do you cope with it? Because it's exhausting. It is very stressful and it really weighs on you mentally, emotionally, physically, financially, right? But there are many strategies that you can use to help cope with emotional stress when you're in the process or on the journey of grief. Um, and some of the things is really labeling it. What are you feeling? Like I asked you just to reflect on your journey, but what are you feeling? Like labeling the emotion or feeling or symptoms of it, right? Studies show that naming the emotion reduces the intensity and increases emotional regulation when you can really identify what it is and then what can I do to help alleviate or mitigate this emotion. The next one is my favorite. It's writing. I love journaling. I love writing. And I always tell my clients it's important to journal and write because you remove the things out of your head and you create some distance between you and the thing that you're ruminating over. So, writing helps you process your feelings and provides insights and release of things. Because many times what's causing the stress is that we're ruminating on it. We're thinking about it over and over and over again, and we are not releasing it. So you're releasing it in writing, and then next would be like words. Are you expressing it? Can you say it? Can you say how you're feeling? Can you identify it, right? And then you can really start processing it. Spiritual practices. If you are spiritual or religious, prayer, meditation, rituals often help individuals deal with grief. It's something you can lean on, whether it's your faith, but something that really grounds you. And you can, say, well, my loved one is with the Lord, or, whatever it is for you. But spiritual practices is a way to cope. The next one is mindfulness and deep breathing. I also love this because it helps you regulate your nervous system. When you grieve, it can be very stressful. And I also look at grief as it's an internal stressor, right? Because we can't see grief. You can't touch it, it's intangible, but it's a phenomenon that you're experiencing, and everyone's experience is very different. But being mindful and going within yourself, that deep breathing, regulating your nervous system, calming yourself, and being present as to what's going on now can really put you in a place to start really coping with the grief. And I want to state that coping with the grief doesn't mean it's going to go away, right? But it's just a way to kind of help move you forward a little bit. And then creative expression is the other one. Art, music, dance, are ways you can really express yourself. So when I think of grief, I think about stress as well. I kind of think of them because if I'm grieving, it is an internal stress in my mind, right? Because it's something that we can't see, but it's impacting your body, whether you know it or not. And we did a workshop on stress last month that you can look at on our YouTube channel. But it is a type of stress, and that expressive creative expression is another outlet, right? The dancing, like you're moving it out of your body, the music, like what music makes you feel good or just soothes you a little bit, or even music that may make you cry, right? Maybe a good cry. Many times people are grieving and they haven't cried. I'm sure you probably heard that before. Or you yourself say, I haven't cried, I haven't processed it yet, right? But that creative expression can also be a way. And therapy and support groups are another way of coping, which I am a big advocate of, that we don't have to do anything in this world by ourselves. Sometimes we feel that way because whether it's that's how we were raised or that's just how we always did things, but we don't have to do anything alone. So grief counseling is a very helpful way to kind of cope with grief, to wrap your head around grief, community, so peer groups that you can go to where other people are grieving. Um, I see this a lot with caregivers. So I am an advisory board member for a cancer caregiver group, and it's just a nice community where you just feel like, oh, someone understands me. If they lost someone and you have someone kind of validating your feelings and what you're doing or not doing it, and kind of giving you permission, it just feels good to be in community. But I would say that, and then just the therapy or counseling, just to kind of work through it, right? So I want you to take a minute and I want you to just think about what's one healthy way you've coped with grief or something new that you're willing to try, or even that you feel that you can tell someone to do if you're not the one grieving, you're here for someone else. But what is one healthy way you have coped with grief, right, in the past or currently? Or what is something you're willing to try based on the strategies that we went over? So we went over labeling it, naming it, right? Giving it, identifying it, writing or journaling, spiritual practices, being mindful and deep breathing, that self-regulation, creative expression, whatever that is for you. It can be art, it can be music, it can be dance, or it can be therapy and support groups. But what is one thing that you were willing to try or something that's already working for you? And I would say if you already have something working for you, what is something you can add? Something you can add to really help you cope with that grief. All right, so keep that for yourself. And I want to go into connection. Connection is so important. And that's why I really love the strategy of community and peer groups. And, like I use the example of caregiving. Social connection has been shown to really help with grief, especially that complicated grief. It really helps patients and caregivers really cope because in this space, you do feel that validation and you don't feel alone. And many times when we are grieving, so if we have a loss of something, so, we're talking about cancer here, you have a cancer diagnosis, or you're a caregiver for a patient and you feel the loss, and it can be so many things. It can feel lonely and it can feel confusing. And I always talk about identity dissonance because when you are grieving, many times you've never been there before, so you don't know how to be. But then who people perceive you to be, you feel like you still have to show up as that person, or who you perceive yourself to. It's just all complicated. It's like, what's my identity? How am I supposed to behave, right? Like I'm grieving, I'm feeling these feelings I've never felt before, but I still have to show up to work. I still have to show up as a mom, a dad. It becomes very complicated. And you're doing things that you haven't thought you would do, or you don't know what to do, right? You don't know what to do with all these feelings that you're having. But when you're in community, you get the validation and you get to like take off your mask, right? And you just get to be the person you're feeling at that time, whether you're grieving or whatever it is. But that community is just a place for you to go and really just relax and be, and be heard, be seen, be validated, right? Tell your story, hear others' story, help others, right? What's helping you? But community is so important. And one of the barriers that I see with community is that people want to kind of keep things private, or I'm not a community person. I hear that all the time. I'm not a community person, right? But when you're grieving, sometimes you've never done it before. So I always say when you haven't done something before, you're experiencing something for the first time, the biggest thing is you have to be open to trying new things, right? So you have to be open to community, open to possibly therapy, right? Some people say, I will never go to therapy, right? Because some people equate therapy to whatever, being crazy or being whatever. But you have to kind of reevaluate that and be open to change, open to try something different because you've never been here before. I don't know what this is, right? This grief, these feelings. So if you're open to it, you can definitely open yourself up to really cope with the feelings and grief that you may be having. All right. So next, I want to go into resilience. And when you think of resilience, like what do you think about? I mean, everyone talks about being resilient and the bounce back, and then we're good. But I think with grief, it's a little different. I think resilience, when we talk about grief, is more so honoring what you've lost and still finding purpose and hope in where you are now. That's what I think of resilience. It's not a bounce back, because I think grief is a personal journey. I opened up saying it's a personal phenomenon. So it's not something like you bounce back from, so to speak, right? It's kind of like coping with it. But I think it's really honoring, right? What you've lost, who you lost, but still being able to find purpose in your life now, if that makes sense. So I honor this, I'm aware of this, but then really understanding that you still have purpose. And I love this definition because at Collaborative Cancer Cure, this is why we exist. It's really to help individuals understand that they still have purpose. There's still hope. We can work through this together. We partner with you to kind of get through, and really wrapping your head around the loss or the diagnosis or the caregiver stress or whatever it is you're going through, right? But that there's still hope there. What are those strengths you can lean on? But in order to do this, we have to be open to having someone come in and partner with us and really reaching back, when someone reaches out their hand, when we are, in grief or in that process, many people say, what can I do? Right. And sometimes you don't even know what to say. Right. But if you have partners, you'd be like, okay, say this, ask for this, make a list of things, that people can help you with. But you have to really be open to that. But it really is honoring your loss while finding your purpose now in the world, because the world is still moving. But how can you purposely still move through the world despite the loss? And that seems like a lot to unpack. And I think one way you kind of foster that is really having some self-compassion for yourself, being gentle with yourself, and not being judgmental or resentful to yourself. And sometimes this can be hard depending on who you are or how you honor self, how you interact with self in the past. But that self-compassion is very important. Routine can also help you foster this resilience that I'm talking about, this definition. But what is your daily practices? What brings you stability, what brings you hope, right? So this can be affirmations, this can be, moving your body, but how do you honor that? This can be just doing the work of figuring out what is your purpose, right? What are your goals? What are your aspirations? Do you still have them? Where are they, right? But some sort of routine or rituals, or going to a support group. Physical activity is another thing, but this is taking care of your body and your mind in order to, process that, right? So physical activity has a lot of benefits in honoring yourself. Cognitive reframing is another thing, is retraining your brain to challenge the negative thoughts and focus on some of the strengths. And sometimes, when people are grieving, they feel like, and I'm talking about this in context of losing someone, or losing self. They feel like if they move on, they're forgetting that person. But I think in the definition that I use, that's why, like, you still honor that person, right? That person is, you're still honoring the person, but you're still honoring yourself as well. Because we have to still make sure that you're well, right? Because you're still here. You're still doing work here in this world, right? You still have purpose. So it's giving you the hope to honor hope. And both can be true at the same time. I honor the loss and I'm still honoring myself. And that can be a new self, right? Or an old self, however you want to kind of look at it, but they can both exist at the same time. And meaning making, which I love this one. Meaning making is really transforming the grief into purpose. So this one makes me think about, if you have experienced the loss, and whatever it is, so whether you're a survivor, whether you were just diagnosed, but really channeling that into helping others, right? So maybe starting a support group, or starting art therapy group, or just telling your story, right? Just going out telling your story. And you're seeing a lot more of that on social media, where people are documenting uh, their journey, but that's meaning making. So that person is really providing um, meaning and hope for someone else, making them feel good, but doing great work, right? It's a nice way to cope and to find purpose in the grief that you may be experiencing. So I want you to kind of reflect a little bit on what is one way you can be more resilient this week or today? What is one thing you can do to honor the loss while honoring yourself? What is one thing? I always like to talk about micro shifts. What's one micro shift you can make to really honor the loss, but honor self, who you are. And I'll give you a couple of minutes to really just think into that and just document it for yourself. Very important. And I would say with that one, I would love for you. I love Post-its. So if you can really identify the one thing, I would say you could write it in your book, but make a point to write it on a Post-it or a piece of paper and put it somewhere where you can see it every day, whether it's on your computer, on your mirror, or whatever it is. But as a reminder, of how you're going to honor yourself or honor the one you lost or the thing you lost. So I would challenge you to do that. All right. All right. So we are coming to the end of this, and I want you to know that grief is not a math problem. It's not something to solve or get over. It's an experience, right? And it's an experience because you lost something or someone you love, and you loved that thing or that person or whatever it is, right? And you cared for it, you loved it, you took care of it, right? So it's important that you understand that you are also important. You have to take care of yourself during this time, and that you don't have to do it together. I mean, you don't have to do it by yourself. You could do it, with someone else. You could do it together with a community, but not feeling like you're alone. And the last thing I want you to think into before we kind of end this is I want you to write one word or one sentence or one phrase that you want to take with you from this session today. One word, one phrase, one sentence, just something that resonated that you can think about tomorrow, next week, something that you can share with someone, just something that you can take with you from this session, whether it is a way to honor yourself, understanding what type of grief you're experiencing. But what is one thing that you can take from this whole thing for yourself today? And I would love you to write that down, but also I would love you to put it in the chat if you can, if you feel comfortable. No pressure, right? There's low stress here. But what is that one thing? I would love to just see what you come up with. Meaning making. Yes. Thank you. But what is one thing? One thing. Anyone else? No pressure. That's okay. All right. Lean into it. Yes. Lean into it, all the way into it. Yes. Patricia, you have a question? I see your hand up. Do you have a question? Can you put it in the chat? Or would you like me to would you like me to unmute you? Honoring, yes. Okay. All right, Patricia, if you can tell me what you want me to do in the chat, I'll do. I don't want to put you on the screen if you don't want to be on the screen. You just tell me what you want and I will do it. I can let you speak, but then everyone's going to be able to see. Let me just see here. Hi, Patricia. Did you have something you wanted to contribute?
Unmute. Oh, there we go. Can you hear me?
I can.
Oh, okay. I'm sorry. I don't know how to use the chat.
That's okay.
Um, I don't know where to type, but anyway, I really like the part about honoring the loss and honoring self, and I also liked the idea of using creative expression. I thought those were both very valuable.
Yes, thank you so much.
You're welcome.
And I appreciate you being here. All right. Well, thank you all for this. Thank you for showing up. And I just want to leave you with, grief in the cancer journey is real, it's valid, it's shared, and coping. And with this doesn't mean you're forgetting. It means remembering, really, right? Less pain and really more peace, and more so peace of mind. And before we go, I want to just give you this. I put this resource in the chat before some of you got here, but I'm going to put it here again. It's just a list of grief resources, groups, support groups, articles. So you can take that, you can share it, you can use it yourself. And then I will also put our website here. We have a lot of different things going on. We have our cafe conversations every Monday at 12 p.m. You can come and join us. There we talk about really life, right? But cafe conversations about life. And that's, open to everyone, but I'll put that there. You can go on our website and register. And of course, if you need anything, please don't hesitate to call if you need any additional support. So thank you so much for your time, and I hope this was helpful. And that's all I have. Thank you so much for joining.
Thank you.
You're
Thank you.
welcome. You're welcome. Thank you so much, Doug.